All right, good afternoon, everybody, and welcome along to the second session of day 2 of ALYFE Connects, our first ever virtual-only digital event. Today's second session is one that I'm very much looking forward to and one that I think we should all pay particular attention to now that we're all working from home, many of us in unfamiliar spaces, and indeed in makeshift offices. I know I myself am working from the kitchen table rather than a regular office desk. And as such, I found that it is just that little bit more uncomfortable. My posture is suffering slightly, and I need to be much more aware of my habits and my physical posture when it comes to sitting like this for a long period of time. So with that in mind, today we are welcoming Dr. Daniel Tan, a qualified chiropractor, of course, and owner of the Aligned Clinic, a clinic that specializes in chiropractic and spinal health. Welcome, Dr. Daniel, and thank you very much for joining us.
Hello, hi. How are you doing?
I'm doing quite well, thank you, Daniel. Actually, I'm as much as I miss the great outdoors, as it were. I'm actually getting quite comfortable working from home, although possibly too comfortable, to be honest with you. And I know that comfort doesn't always equal correct posture, which is why I'm very excited to talk to you this afternoon. But I don't mind it. I'm getting used to these four walls, I suppose. I'm enjoying I'm enjoying not commuting anymore, which is nice. But I'm looking forward to hopefully the lockdown lifting quite soon. So fingers crossed. How are you doing? How are you over there?
Not too bad myself. Been doing trying to create some videos to educate people of the importance of our spine and how to remain a proper posture. And a lot of them been asking for exercises which can help them with the neck and the lower back. So all of that I've been focusing a lot in that, and also been doing some reading as well. So all good. I actually quite enjoy life like this, to be honest. The only thing that I'm missing is interacting and helping my patient.
Yeah, sure. I think that the first cold glass of beer out at the at happy hour, when all this is over, will taste all the sweeter, I'm sure. But it's been an opportunity to reset, recharge, reflect, and find some time to prioritize some personal matters, maybe.
Yeah, exactly.
Just to let the audience know, I'm sure the videos you just mentioned, they can be found on your Instagram account, no doubt, which should be at the bottom of the screen now.
Exactly.
So please do look up Daniel on Instagram. He puts up a lot of very informative content, and of course, it's all for free. So make the most of that while you can. I'm looking forward to hearing what you'll be sharing with us this afternoon, Daniel, with regards to correcting posture and whatnot. I think it's a very important topic to address in this day and age, because we are a lot of the time really unaware of the damage which our modern day behaviors, if you like, are doing to our bodies in terms of overall kind of posture and spinal health, in the sense that, for example, we spend about 12 hours a day staring down at our phones, right? Which is putting a huge burden on the back of our necks. I saw a diagram somewhere, and please, you'll have to give me the correct figure, but I saw a diagram which basically means that if you're holding your neck at like a 15-degree angle over the course of the day, that's basically like hanging a 15-kilogram weight off your neck or something like that. We would never feel that within ourselves until it's too late, and you start getting really, really sore, and so on. So I think our modern day behaviors and slouching watching TV, or hunched over the laptop, or staring at the phone, are doing more damage than we think. So please talk us through some simple ways to address these common behaviors.
Sure. I think what's interesting with what you mentioned just now is that a lot of us, we actually only realize that we are uncomfortable after we feel uncomfortable. The thing though, it's actually a really good idea for us to constantly remind ourselves to move around. You see, what I always tell my patients is that if you do remember when you're at your younger age, you don't really have that much of pain because we are active and we are constantly moving around. But as we start to age, we tend to spend a lot of time sitting in one position. Like we're sitting on the desk all the time because of how people want us to behavior, like the society behavior. We have to sit properly, and we don't move around and fidget around, and like all that prolonged sitting and prolonged standing or keeping in one position for a long time really does damage our spine pretty badly over time. And the thing is that people, they only tell you that they're hungry when they feel hungry. They only start eating when they're hungry, but supposedly we should eat consistently according to time. Same goes to our posture. Like, it's best for us to just move around from time to time rather than, starting to feel sore, then only we move around. So
cool. I know you're a big advocate of preventative care, of course.
exactly.
Like you should take a proactive approach and preventative approach to this kind of health rather than, driving your body, running your body into the ground and then seeking corrective help. You should be taking active steps to address your posture, even if it is just getting up once every hour for a few minutes and just stretching your legs, that rather than all day and then trying to fix it at the end of the day. For example,
I'm really curious. Like, personally, do you have any experience with any lower back pain or neck pain that affects you from?
Yes, I do actually. My mostly my lower back. I found. See, I made the mistake when I was at university, or basically when I started going to the gym and taking exercise seriously. I made the mistake, like a lot of people do, of always skipping leg day. Now you're a bit of an athlete yourself, Daniel. I know you enjoy a good workout, and I know that as a medical professional, you'll understand the absolute priority and urgent need to have a balanced body and a balanced body composition. Now, when I was younger, I was focused squarely on the beach muscles. It was 4 times a week. It was 4 times a week, upper body, chest and arms, and shoulders and back. And so over time. And it was really focused actually on the chest. So over time, I found that my chest was pulling my shoulders forward, so I was having a natural hunch in the back, and the general imbalance in my upper body versus my lower meant that my legs were supporting an imbalanced amount of weight, which was putting an awful lot of pressure on my lower spine, which in turn was then causing my hamstrings to become really, really tight. And what I learned was really how, and you'll be able to tell us a lot more about this, I hope, is just how interconnected the body's systems really, really are. How tight hamstrings can ultimately lead to a crick in your neck, and so on. So so I sought out some chiropractic help at the time, but this was a few years ago, and I've not been able to keep up with regular treatment as I wanted. But certainly I have. I've had some experience with back pain.
Right. I think to answer your question, that's actually a pretty good question. Like, there's a lot of people or a lot of patients always been asking me, like, what's causing the pain? Is it the muscle that's causing the pain, or is it the spine that's causing the pain? What should we do? Like, can I do exercise that help me to reduce the pain? The thing is though, if you do have any pain, okay, to anyone that exercise out there or anyone who's listening for now, if you are active in exercising, you will know that if you have any muscle soreness, it tends to go away after a few days' time. That's how it works, right? Because our muscle generally, they recover pretty quickly. But if you do have any tension or any tightness that's been there persisting for more than a few days or a few weeks even, so those are generally a joint issue. The pain that you're feeling, it's a nerve pain. Means that some part at the joint, it's being damaged and you're having some problem at that part of the joint. So what it does is that joint, there is swelling, and that swelling is actually affecting the nerve. So in chiropractic terms, we call it a nerve pressure. So when you have nerve pressure, for instance, if you've injured the neck, okay? So a lot of people, they've been feeling tightness at the traps, even go down to the hand. I'm sure a lot of people can relate. And this kind of pain really comes and goes. So sometimes you feel it, sometimes when you move around, they feel it, oh, it's all right. It comes and goes. So what happens is when you have excessive swelling, so say if you're sitting in a position, you're aggravating it for a long period of time, then it starts to swell up. And when it's swollen, you start to affect the nerve by pinching at the nerve. So that's when you start to experience all the symptoms. And naturally, when you start to move to a better position or after you rest and you come back up, the pain will generally go away. That's at the beginning part of the pain or the condition. So if you leave it there for a long period of time and it starts to worsen, so this pain will become more persistent, it become more obvious, and the intensity will become more intense, obviously.
Sure.
And this problem here, it's kind of like a decay, we put it that way. So if you have a problem as such, a lot of people, because they feel like it's okay, I can tolerate it for a while. But when you leave it long enough, it will start to cause a lot of degeneration at the neck, at the joint.
Right.
So that's when problem become worse. That's why you hear a lot of things about bone spurs or auntie complaining like constant pain and whatnot. So
and when it gets to that point, then of course rehabilitation and treatment becomes a lot more difficult. At what point is it just more about damage control than it is about treatment? You know, how late can someone leave it before it's too late to treat these kind of conditions? You know?
Okay. That's actually one of the things I want to talk about. That's a fantastic question.
Okay, well, let's leave that then to because I know you have some discussion points prepared. So please don't let me interrupt. Don't let me jump any further forward. We'll come back to that when you're ready.
I appreciate you raised up the question. I think a lot of people have been asking about that as well. I think let's put it this way: as a general rule, our human body. Okay. Let's put it this way: for bodybuilders, for example, they always have the phase of let me bulk up and then let me cut down to a leaner stage. You know, they have that stages.
Yeah, very true.
The truth is though, our body doesn't work that way. Health is something that you need to constantly put in effort on. It's not like today. It's not like today I can just, for example, it's not like I can sleep very late for a long period of time and then I can catch up with my sleep. There is no such thing as catching up with my sleep. When you sleep late all the time, you're basically damaging your body over the time. So as you try to restore it, yes, you might be able to repair it, but have to remember that destruction and construction, they're going on constantly at a time. It's not like I can let me damage my back first, then I recover it after after a month or 2 months when I feel that the damage is enough. It doesn't work that way. It has to be constantly improved on.
Yeah, because you can never quite go back down to that original baseline, can you? You can't just like you said, you can't just destroy your body for a few days and then say, oh, it's fine. I'll if I sleep just as much as I didn't sleep, it'll be back to zero. But there's no back to zero, because it's a constant battle within the body. So this is why prevention really is so much better than cure in that regard.
Exactly.
So in very simple terms, Daniel, one question for those watching at home who might not know exactly what it is that you do. For example, a lot of people think chiropractic and they just think that great big back crack that everyone seems to be going for these days. But in the simplest terms, what is it? In your day-to-day role as the owner of a chiropractic clinic, what is your main medical responsibility? If I can put it in those terms, Daniel, what is it in the simplest terms that you do?
Okay. I think just like any other specialist, they take care of a certain part of the organ. Like for us, we take care of the spine and the joint. So what's so interesting about the spine is that if you think about it, right, any object in the world can be displaced. Means that if I have a phone today, if I push it, it can tilt to one side. Is that correct? So actually, same goes to our body. Some people here who's listening, or even yourself, you might have experienced or you might have seen someone who dislocated a shoulder before or dislocated a jaw before. I'm sure we all know that. Yeah, we are familiar with that. But many people, they have a difficulty in understanding or relating how we can displace our spine. But the thing is, our spine, it's a vertebra, right? Like there is a lot of bone that's stacked up together. Yeah. So sometimes with our vigorous activity or just really bad posture for a long period of time, our bone can actually displace. Means that the bone can actually shift up. So for example, if you have two bones here, so when one is off position, we can actually push them back. Yeah.
Even demonstrating like that makes me feel a bit queasy in the back of my spine. But when you talk about displacement, it doesn't, because people talk about slipped discs and they talk about trapped nerves and things. It doesn't have to be something so extreme as like, we can dislocate the spine in ways which aren't quite as serious as they might sound at first. But even having things slightly out of place in the spine can cause bigger problems elsewhere in the body. Is that correct? But you wouldn't necessarily treat them as seriously as you would like a a dislocated knee at first. You just put it down to a bit of soreness in the back and go on about your day. But it turns out that might be a lot more serious than it turns out at first, right?
Yeah. I think to answer your question is that there is always a degree of the displacement, or dislocation. So of course, when we talk about, like those cases where we see people dislocated the shoulder, the whole thing just drop off. Those are when the whole bone has displaced out of the joint. So if that's the joint and that's the bone, the whole bone just went out. But bone can always stuck in a position where it just is slightly displaced and it got stuck, but it can still function in that position. It's just that the function of the bone is generally is greatly reduced. Does that make sense? Yeah. So a lot of the time, people, they have neck pain or lower back pain. What it means is that the bone is slightly displaced and is causing a lot of swelling. And when we talk about pinched nerve, it's not that the bone is crushing on the nerve; it's the swelling around it. It's pressing on the nerve.
I see. Okay.
So it's pressing on the nerve. That's why, because swelling can reduce and it can increase again, depending on how you aggravate it. That's why the symptom comes and goes.
I see. Interesting. And so, what is typically, how would you alleviate that swelling? What is it you can do to treat that swelling around? Because it might be coming from, correct me if I'm wrong again, but maybe a pinched nerve somewhere in the body might be coming from swelling caused by a displacement somewhere else down the line, somewhere in a different muscle group entirely, for example. So what is it that you're looking out for when it comes to like sort of treating pinched nerves, and how do you alleviate the swelling that's causing that pinched nerve and the pain?
Right. If you ask me, okay, so when we talk about swelling, the best way to go about it is to measure and is to examine and make sure that there is no any bone displacement, or we call it as a subluxation, means a partial displacement, right? So we make sure that the bone is in the best position. So that's the best way to go about it, which is why you require a chiropractor to help you to check the spine and actually adjust the bone. We're trying to get the bone back to the right alignment, right? But sometimes, for example, during an MCO period like this, we can't get a chiropractor. The best way to go about it is to make sure that the spine is in the most neutral position as possible. So, for example, I'm just going to turn to the side, okay? We're going to talk about using laptop, all right? So, just like you say, a lot of us, when we work in an office, this is what we do. We have a laptop. We're just going to go like that. So, the head's supposed to be on top of the spine, just like this, right? So this is the spine. If this is the head, it's supposed to be like that. But right now, you're putting the head here. You can tell that the neck here is actually suffering from a lot of pressure. So when that happens, generally it's going to put a lot of pressure. And if you do have any spine issue, that's going to start to create some swelling going on there.
Sure. We've got a question come up on Facebook, Daniel, which is relevant to what we're talking about. If there is a pinched nerve, do you recommend traction as a treatment? Is it traction that is you referring to correctly? As a treatment? So is that something that you recommend?
Okay, so
what is traction for those that don't know, including me?
Okay, so to those that doesn't understand, basically traction, what it does is that it's a form of treatment where they'll just hook up a string here at the neck, like a.
I've had that before.
Okay, they'll tie up here, and then they'll tie up the leg, so they'll just pull the body.
Oh, it's beautiful.
So they'll just pull the body like that. Okay, some it really depends though. Traction does have a good results in a certain research, but generally speaking, in my advice, I don't think that it's the best solution out there, because when you track the spine, yes, it does give you the instant relief and it gives you the big crack and all, but there is always a chance for you to damage the good ones. So let me put it into perspective. You have a lot of segment at the spine, okay? If you do damage the lower back, that particular one segment, and when you start to track, you might injure the rest of the good ones. Does it make sense?
Yeah. So you don't want to sacrifice one to save the other, kind of thing.
Exactly. So it's always better for you to go specific. That's why when you look at some of the way that we do treatment or assessment, we're actually very specific. We have to check the whole spine and make sure that, for example, L5 or L4 is the only one that have problem, then we'll only work on that one. We don't work on everything. So there is a lot of a lot of Chinese sensei out there you've been seeing. They do the whole crack, they crack the neck, turn left and right, the whole body.
Yeah,
it looks good, but generally, if you think about it, it doesn't make sense. If you have a vertebra, okay, the bone, right? So all of them stacked up. If you have them turn to the right side, accidentally, say you accidentally cracked it this way, and the bone displays to the right side, okay? So why would you want to crack the neck to the right and to the left again? You're not doing anything to change the rotation. So what you want to do is crack the bone back to the right position. Is that correct? So
yeah, sure.
There is no point for you to not do any assessment and crack both left and right side. You're actually damaging the bone. You're damaging the spine in the long run. It's not a good idea.
Just for the sake of that sound, because it looks good and it sounds better, and people
feel good about it.
Yeah, people associate that sound. I mean, there are hours worth of videos on YouTube, with this ASMR, this audio sensory, kind of effect where it's just like hours. And I admit I'm guilty of watching a couple of them, but it's just hours of crack after crack after crack. So people associate that with, that it must be cracked back into place, but God knows, sometimes cracks mean a great deal of damage has been done too. So point taken entirely. We've got another couple of good questions, which we will come back to, guys, at the end of the session. But I feel like I interrupted you slightly, Daniel. Sorry, you were talking about posture while at the desk and while hunched over a laptop. So you were talking about how the head should be at the top of the spine, not hunched over.
Yeah.
What else should we be looking out for when we're, say, going to be at the desk for up to 8 hours a day? Shoulders back, head straight. What else should we be conscious of doing when we're at our desks?
Again, like I say, I think generally speaking is to constantly move around. The few things that you have to remember: first, just generally keep the heads up if it's possible, and try not to tense up the shoulder by bringing it up and put your hand on top of the desk like that. So, for example, I'm just going to move the screen a bit, okay?
With my posture now.
Yeah, if you're using the laptop, okay, just make sure that the table is not too high. So if the table is too high, you end up doing this, right? You're typing like this. Yeah. If it's too low, then you put your hand like that as well. It's not comfortable. So you have to keep it just about 90 degrees. It means that the shoulder has to be relaxed. That's a good idea. Another big important part is that you have to keep the back supported all the time. So don't sit up like this. Don't leave a gap like that. So you have to sit all the way in.
Yeah. Understood.
Yeah, and just generally try to move around. The more you move, the better for your body. So
see, honestly, I'm quite lucky at home here, because even though I'm using my kitchen, my dining room table as a makeshift desk, I still have like a pretty comfortable, proper office chair with me here. So I've got quite good lower back support. I can sit straight, and it just happens to be, I think, at the right level for me. But there will be people watching at home who, are sitting in very straight back wooden chairs, which are maybe the wrong kind of height for them to be working comfortably at the desk. So what can they be doing, say, every hour? Again, what small preventative measures, like, just small stretches, perhaps, what can they be doing at home to manage their spinal health and their posture? What quick desk stretches would you recommend?
Yeah. To be honest, that's actually something that is really tough. It's one of the toughest things that I'm facing even in my practice, is to help patients to prevent the problem. So the thing though, when it comes to, say, if you're sitting on the couch, it's hard for us to tell if the couch is supportive. Like the patient will tell you, oh, my couch is good, it's comfortable, it's supportive. But until we really go and assess it ourselves, we can't really tell them, what's the best couch. And most of the time, patients are sitting on the couch where they've been using it for a long period of time, the whole couch just sinks in, or they're sleeping on the same mattress for a long period of time, the mattress just sinks in, there's no good support, and all this can eventually create a problem.
Sure.
Yeah.
Comfortable does not always mean correct, of course. Even if it feels just right, that might just mean that you've gotten used to something which wasn't right for you in the first place, but now it's just what you know.
So
again, prevention and proactivity.
Yeah, I've seen a lot of patient or people that sits in a really bad position, and they tell me that they're really comfortable about it. So
I bet.
Yeah, you get it.
Quite frustrating.
Yeah.
People who promise you the best possible. We've got some, by the way, to the audience on Facebook, thank you all for we've got some great questions and comments here, which again, we'll get to at the end of the session. Definitely, I'm looking forward to some answers for some of these too. But Daniel, you mentioned some points that you wanted to share for this session. Well, what is it you wanted to share with us?
Okay, hold on. I actually have a presentation. Let me just see if I can put it up. It talks about the pelvis, so I think it's something interesting for people to see. Just give me a minute
cool.
here.
Sure, no problem. This will be interesting.
I will also need to charge my laptop. it's kind of dying. Just 30 seconds. Hold on.
Okay, no worries. I tell you what, guys, we will take a very quick break while Daniel goes to get his laptop charger and prepares his slides. So please, in the meantime, keep the questions coming. Think about anything you would like to ask Daniel with regards to spinal health and good posture and preventative care as well. It's much better to think prevention rather than cure, because we never know when it might be too late to correct the damage that has been done. And as wonderful a thing as the human body can be, we're very resilient, very tough. At the same time, it's amazing just how a slight misdirection in your neck or the way that you hold your lower back might do to you over a period of time. So please keep the questions coming. And I believe we can get back. Oh no, and we don't need a break at all. I think Daniel is back with the charger. Good stuff.
Okay, so all right. Should I just click share screen here?
Yeah, please share screen at the bottom, and I will add you too.
So share screen. Okay. Application window.
Technology. It's okay. It should come up in a second. Technology never works as you want it to work.
Okay.
Here we go.
Are you seeing it? No.
It should be coming up just now. There we go.
Is it working?
Yep.
Okay.
I can see it. So if you click play and just talk us through it, that should work just fine. There we go.
Okay. So we're gonna first talk about the pelvis. Okay. I'm gonna go through it fast because I'm not sure. Okay. All right. Let's start. Anyway. So how important is the pelvis? The reason why I want to talk about this is because I think that the pelvis is very important. It's something that a lot of people didn't realize. In fact, I would say that most people with lower back pain, generally speaking, 60 or 70% of them, when they come into the clinic, majority of the issue is actually a pelvis issue. They have an injured pelvis rather than a lower back problem, which is the lumbar spine.
Interesting. Maybe I should consider that one. Yep, this is very relevant to me.
Yeah. Anyone that exercise out there, or anyone who's more self-conscious about how the pelvis look, a lot of the time we heard about the terms of muscle imbalances, pelvic imbalances. So we heard about pelvis tilt. Okay, do you have anterior pelvis tilt? Do you have a posterior pelvis tilt? By the way, Jacob, can you still see me though? Like, am I still on the screen?
Yep. You're still on screen.
Yeah. So I'm going to stand up and I'm going to show you. So what we always heard is that we have. Can you see my pelvis at the side?
Yep.
Okay.
Let me
try. A lot of people saying that they have anterior pelvis tilt, posterior pelvis tilt, or even imbalance on one side or the other. So many times you're trying to do a lot of exercises to correct problem like this, but the truth is it's actually not like that. A lot of the time is because when we were younger, some sort of accident occurs. We fell down, we hit the whole pelvis, and the pelvis just went off position. So if you look at the figure here, you can see that between the ilium, okay, and between the ilium and the sacrum is the tailbone, ilium is the big bone at the side, on left and the right side. There is one joint that's connecting that It's called the sacroiliac joint. It's on the left top corner. Can you see?
Yeah. Yep.
So the sacroiliac joint is the one that is primarily supporting the whole body. So if you, for example, hit the ilium on either side, they can actually have a misalignment, and one side can go up. I think I have another picture to show you. I'll show you later. Okay. So when that happens, at the sacroiliac joint, there's going to be a lot of swelling. And if you can see here, there is a lot of nerves that comes down from the lumbar, from T12 to L5. There is a lot of nerves that come down. Ilioinguinal nerve, for example, genitofemoral nerve and whatnot. But all these nerves, it has to go through the sacroiliac joint or that region around there. So when you have a lot of swelling going on at the sacroiliac joint, it's going to start to give you some nerve pressure around that region, which can then start to give you a lower back problem. And
it's a lot of pressure,
yeah. And this is only a small part of it. If you really want to put a bigger picture or more detailed picture, you can see a lot more nerve going on around there. So people might have radiating leg pain or radiating leg numbness and all. It all started because of the lower back. The lower back is affecting the leg. So it's something for people to digest it.
Yeah. So this is what I was referring to earlier. It's amazing, unseen, almost the unseen damage that we could be doing just by like to the rest of our bodies, because one particular zone happens to be such a crucial pathway in the body for nerves like this. Okay, so this is very important in the pelvis health. Okay.
And it's just a lot of people, they can't really relate, why I'm having a leg pain. Because, it's funny, patient comes into the clinic, tell me that they have leg pain, and the first thing I do is to check the pelvis. So a lot of them, they feel like, why are you checking my pelvis? My problem is my leg. But a big part of it is because the pelvis is damaged. That's why you're having leg pain. And because it's a nerve pain, it really does makes you feel like it's a leg pain. Because the nerve is the one that's controlling your sensory, right? Without the nerve, you won't be able to feel a thing at the leg. So then, naturally, when the pain is at the leg, people think that it's a leg problem. So it's interesting. It's interesting like that. Okay. So
the natural fact is happening somewhere else.
Yeah. By the way, at this point, do you have any question they want to raise, Jacob?
I think, I think there are a couple of good comments on the Facebook group, but the ones that I think we'll come back to, because they were there from before we started the pelvis presentation, if you like. But no, I think so. I don't want to overcomplicate things or confuse anybody, because it's a lot of important information to digest. So I think I'm good for now. I wasn't aware. I wasn't aware quite that. I knew that there was a big relationship, of course, between of course, the nervous system as a whole, and how important and how you could feel pain in one part of the body which was being caused by something completely different. But I wasn't aware that there were so many nervous pathways going through the pelvis itself. So I didn't know quite how crucial in general postural health that this area of the body was. So please, keep talking. I'm loving this.
I see. Okay, that's good then. All right. Just a side note, right? When the pelvis is damaged, it can also damage any bone at the top part of the spine.
So that we do have which may then lead us nicely onto this question we've just had on Facebook. One user asking if you can get a pelvic imbalance from sitting on your wallet in your back pocket all day?
Okay.
Is it the kind of injury that you talked just now about an imbalance and like doing damage to the top from something happening at the bottom? Is this an example of that?
Yeah, for sure. So you see, from all that cross-legged sitting position, or you have a wallet at the back pocket. So what it does is that it generally causes some part of the muscle to be tighter and some part of the muscle to be weaker. Because when you're doing that in a long run, some part of the muscle generally have to contract more, so eventually it becomes stronger. And some part of the muscle, it doesn't have to contract as much. That's why it's become weaker. So it doesn't cause the damage straight away, but over time, what it does is that it makes the pelvis easier to be injured. because the muscle is already weaker on one side than the other side.
Okay, because it's been contracting for longer over time, so therefore
Exactly.
it's more susceptible to damage it's basically the wear and tear is greater on one side of the body because you're putting that imbalance on it, and this will lead in future to complications.
Yeah.
Interesting. Okay, cool. I hope that Malcolm, I believe, hope that answers your question.
Okay. So now we are going to
Daniel.
talk about the importance of the pelvis. Okay, like what does it do? So generally speaking, we know that it's a basin-shaped complex bones. Okay, it connects the trunk and the leg. So it connects the stomach and it connects the leg, and it's all from the pelvis. It supports all the intestines, the bladder, the organs within the stomach. Okay, if you think about it, it's pretty amazing. It's doing a lot of things. Okay, it allows the baby to go through from the pelvis to be delivered.
Wow.
For the ladies. Yeah, so if you have any pelvis issue or if you have any damage at the sacroiliac joint, ladies is gonna have difficulty for the pelvis to open up, dilate when they're gonna give labor.
Give birth. Wow, the pelvis is literally the source of life, people. Something I did not know until just now. So treat the pelvis with more respect.
Yeah, true. That's good. Okay, and obviously we know that it provides a lot of support to and protection to the nerves. Okay, because of the structure, and it allows movement and normal gait. So this is what the pelvis does. It does a lot more than what we think they do. Okay.
Mm-hmm.
And so generally, this is another graph that I have. It's the difference between female and male pelvis. They actually have some difference in shape and size because ladies, they need to have the pelvis to support the baby for delivery process. So if you have a cadaver, it's just a fun fact, right? If you have a cadaver, you can actually tell the female or the male just from the pelvis. The female pelvis is generally wider. So, you know, like a lot of people say that, oh, if you have a bigger pelvis, or in a more rude way to say, if you have a bigger buttocks, it's easier for you to give birth. Generally, what it means is that you have a bigger canal or the pelvic inlet for the baby to be delivered because the pelvis is wider. That's how people perceive it.
Interesting.
Yeah, so it's a fun fact. Okay. So why am I telling everyone about the importance of the pelvis? Again, because the pelvis can be damaged, right? So how it can be damaged? I think this will answer a lot of questions. So blunt trauma, if you do fall down, if you're sitting in a long position, like in a long bad position, it can then cause a lot of muscle imbalances, like I mentioned. Lack of exercise definitely causes a weaker muscle.
Sure.
How does the muscle work with the joint? Okay, so if you can see me from the camera right now, this is what I want to show you. Okay.
Yeah.
So the muscle serves to protect the joint. So for example, today, if you are strong, a person try to pull you, okay, you can resist. You protect the joint. But if you're not strong enough, same force be applied, your muscle cannot oppose the strength, oppose the force. What it does is that when the muscle fails to protect the joint itself have to take the load. And our joint can take up to a certain amount of load, but there's only that much you can take. When it's too much, it's gonna damage the joint. You can dislocate your shoulder or you can dislocate your elbow. So when you have more muscle, what it means is that you have more protection at the joint.
Sure. Yeah, and it acts as a stabilizer. It acts as a cushion. It's a
very simple concept. Yet sometimes people don't really think about it that way. So I'm just trying to, guide them through with it. Okay.
I get it. Well,
yeah, heavy lifting for sure. If you're lifting in a bad position, that definitely can damage the spine, especially when you're lifting with your back rounded. So a lot of people, they try to lift heavy items with the back rounded like this. So they just take items and they pull. The moment when they pull, they're going to damage the back. So you have to keep your back straight all the time. Squat down and then carry that way. That will help.
Well, yeah, well, you see plenty of horror stories of deadlifts gone wrong and so on, when people are lifting very much from the back and not from the legs, as it were, not keeping a straight back and lifting almost from the shoulders, as it were, rather than generating force through the pelvis and upwards through the posterior chain. On the note of not quite heavy lifting, but on the note of exercise and damaging the spine, a question here from Aidan is asking, will twisting exercises like the Russian twist, will they strain the spine? In your experience, have you found that?
Okay, good question. So if you do have a twist at the spine, Russian twist, for example, what we understand at the spine is that our spine is most susceptible to damage when there is any rotational movement. So, for example, most of the time when patient comes in with a lower back injury, what they will do, what leads them to that is where they start to carry items. You're looking right. So when they carry items, they try to leave from point A, they round the back, they turn, and then they put it at point B. So that's something that we do all the time. When we want to clear off something from one side, we carry, we put that way. So this kind of rotational movement generally injure the spine. So hence my answer to you. We can do a lot of rotational movement, but it has to be under a well-controlled manner. It means that you have to really do it with a good progression and do it slow.
Yeah, sure.
You understand what I mean?
Engaging your core properly. It should be very carefully controlled. You can't just be flailing around,
exactly,
like a crazy person. You've got to control. You've got to be very aware of what your entire core is doing, almost in controlling that. Because Russian twists are a great way to build a shredded six pack. I mean, I don't know why I'm looking at myself. I don't have one, but if I wanted to get one, it would be Russian twists, but properly done, of course. So I guess the answer to Aidan would be Russian twists could strain the spine if you do them incorrectly, like many exercises for that matter.
Yeah.
Right. So sorry, were you done with the presentation there, Daniel?
No. I'm just trying to take a look at the time.
Okay. All right. No worries. So we have a few more. We have about sort of 10-15 minutes left, and we've got some great questions here on the Q&A. If you'd like to take a few from the audience.
Depends on them. I mean, I'm happy to go on with my presentation, or if you want me to just go to the Q&A session, I'm done with it.
Well, let's tell you what. Let's finish off your presentation, because I think what you touched upon there and the importance of of pelvic health above anything is very important. So let's get back to that, and then we still have time at the end to go through a few questions here. Okay, so let me bring you back on. So now I'm kind of looking at a weird inception. There we go. You're back online.
Yeah. Okay, I'm going to talk about the results of the damage of a pelvis joint. So we've already covered, how can a pelvis be damaged. So now we want to talk about what is the consequences. So first of all, once you've damaged the pelvis, you see the pelvis, they're in the middle of the body, okay? It supports the top part of the body, and it supports the lower part of the body as well. So when you have a pelvis that is tilted, for example, if you have one side of the pelvis that's tilted, what it does is that it starts to damage what it does is that it doesn't give you a good support at the top part of the spine. It means that you can have scoliosis, or you can have a body that's tilting to the right and the left at the top. So many people who have scoliosis, a part of them is because they already damaged the pelvis. That's why they start to have scoliosis. But generally, this kind of scoliosis is reversible. So once we've identified it is the sacroiliac joint, we can try to correct the spinal curve. That's doable.
Okay. Well, actually, if I can just jump in very quickly, because this brings us nicely onto a question which I was saving to the end, but you mentioned it, so I'll bring it on now. Chanyi is asking about scoliosis, and if you would suggest bracing as a means of treatment, or surgery for that matter, or indeed more, or indeed less, I want to say invasive. I mean, not that bracing is invasive, but you see what I mean. Could you apply more homeopathic remedies to something like scoliosis, or does it require much more, intense treatment for a condition such as this?
Okay, there is when it comes to scoliosis, the first thing that we need to identify is whether or not it is something that is congenital, or is something that is caused over the time. Okay, So if it's a congenital scoliosis, it really depends. If it's just a mild curve, you see, our body can adapt within a certain limit, a certain limitation. So if it's just a mild scoliosis and it's congenital, we check the spine, everything is okay, it's functioning fine, we can practically leave it and it's okay. Probably the only thing that would become a problem is that aesthetically it doesn't look as pleasing, but the body is normal as it is. Okay.
Yeah.
But
Yeah.
if it's a scoliosis which is very severe, even though it's congenital and it's affecting the organs, it's compressing the organs and all, yes, in that case, maybe you need a surgery. But if you ask me, the best way to go about it is to first get it checked by a chiropractor. So what we do is that we make sure all the spine is functioning normally. If it doesn't function normally, we can try to correct that, and we see what we can help to improve the curve of scoliosis. You understand what I mean? When off limit is something that it reached to a point where we can't control it by natural therapy anymore. You probably want to consider surgery, but you do have to remember that surgery, when it comes to spine surgery, is actually not as beautiful as you think it is. It's not just you go in there and it helps you miraculously like that, because if you've seen videos of footages, basically people put a rod inside, means that you're fused, right? So then you can't really turn. The range of movement is very limited, and it's a pretty big chance where you might damage the nerve along the way, which is really, really bad choice of treatment unless it's necessary.
So even a surgery to that degree still carries with it, risks and potential damage too. I mean, getting a steel rod and implanted in the body can't be pleasant for anybody, even if it is necessary. So okay, complicated one.
I think she was asking about bracing. Bracing to me, I think it could help to a certain extent, but you have to first identify what is the cause. Say for example, if it's a congenital scoliosis, means that you're born with a scoliosis already and there is nothing wrong with it. If you try to put a brace, you're trying to force the body to a straight spine, but you're not born that way. So that can actually cause more damage than what it's supposed to do. Okay.
Wow, it's a tough one. Sure.
Yeah.
Not something you want to do wrong.
Yeah. Hence why the best way is to really just, make sure you get it checked and make sure that there is make sure that we know exactly what's happening right there before we can advise you further. There's a lot of time I receive a lot of people asking me, I have lower back issue like this, can you help me? I have neck pain for a long time, can you help me? I have bone spur, can you help me? But the thing is, if I haven't checked physically, it's hard for me to advise you because I wouldn't know.
Yeah, no, of course, and on that note, I would never ask you to make a recommendation for something so serious over this, something so serious as this, over a simple live session. But Chanyi, I hope that answers your question to some degree. But please, if this is something that you think requires urgent and immediate medical attention for you or someone suffering from scoliosis, please do contact Dr. Daniel as soon as you can, and hopefully as soon as this MRO is over, he will be able to make a much more thorough assessment and a much more composed and accurate answer for you. So anyway, quick sign. So thank you for that, Daniel. So anyway, moving on, you were talking about the damage that happens if you damage your pelvis.
Okay, so we know that it can cause poor biomechanics. So we covered that it can cause upper body to tilt, which means that it can cause a scoliosis. It can also cause a knee problem as well. So if you damage the pelvis, you might have some knee pain from time to time, start to have some osteoarthritis at the knee, which I'm sure a lot of aunties or moms at 40s or 50s, they start to say that, I have some knee pain on one side, and they go and do an X-ray, found out that one side of the knee is degenerated badly, then they start to think that, it's because of the cartilage, it's not good enough. Not at all. It's mainly because the pelvis is damaged. It's causing one side of the knee to have excessive pressure over the time, and you start to have a lot of wear and tear. That's when the cartilage is being damaged or the ligament is being damaged.
Interesting.
It's a
Okay,
thing
so
that's
it really it's fascinating what we're learning here, that the one pain pain in the body really might not be what you think it is, and so and this is why like a full spinal assessment and a full chiropractic consultation can often be a very good way of determining just what that pain might be. And so, by the way, for all those watching at home, we on the Facebook group, we are going to be sending out a survey after this session is over. And in that survey will be a little bit of information regarding a chiropractic consultation by Dr. Daniel, which is a full review and assessment and report on your chiropractic health and identifying areas for improvement and preventative care too. So if you want to think a little bit harder about addressing some of the issues that you might be facing, whether it's lower back pain, whether it's frozen shoulders, whether it's knees or other joints, please do take a look at the survey and get in touch with Dr. Daniel also. His Instagram is just below. Like you mentioned, he's putting out lots of great content, lots of very informative videos. And like I said, they are free, so make the most of them while you can. But if you think there is something more serious to be addressed, please do get in touch with Dr. Daniel when the MRO is over and go visit him at the Aligned Studio. So, Daniel, we've got about 5 minutes left. And there are a couple more questions maybe we might like to quickly address. But before then, let's wrap up on the pelvic thing. If you have anything else to say, how would you like to finish on that?
I think generally we're good for now. Maybe if there is anything, let me just show you guys a picture here.
Yeah, well, this looks really, this looks like, oh my. Yeah.
So,
oh my, okay.
As you can see, this pelvis is not aligned. You can look at the left pelvis is very wide and the right pelvis is very narrow. The shape of the left and the right is not symmetrical. Just want to show you guys this is how a pelvis can be damaged. And this is pretty common that we're seeing. It means that there is a lot of rotation at the pelvis. So
wow.
This kind of rotation can generally put a lot of pressure on one side of the pelvis, and it can make one side of your butt cheek to look much wider, one side is low, one side is narrower. All this is actually within the body that you can't see. Yeah.
So I'm sure for someone like that, I'm sure there's no quick fix. But what are the steps that you, as a consultant, take to address that kind of imbalance? I mean, it looks like a very serious imbalance happening there within the lower body. And how do you begin to correct that? Is it with correct, like physically corrective measures like the whole cracking thing, or do you set out on a program of stretching and smaller corrections at first? How is it you begin to fix a spine that looks like or a pelvis that looks like that?
Can you see the cursor, like my mouse cursor?
Yes, yeah, we can see that.
So what we do, the first thing is that we will have to look, we have to do inspection visually. So we have to look at the person and see where the suspicious area. Then we'll basically do physical examination. We call it a motion palpation, which means we are actually checking the movement of the joint. So say these two areas here on the left and the one on the right, basically what we'll do is we'll have to check the bone and see if the bone is gliding on top of another smoothly and is functioning. We have to check for any swelling, and we have to check for any inflammation by detecting the temperature, if it's increasing or it's not. So after all this examination, then we have to look into the symptoms, the history, if there is any trauma. Then we have to get an X-ray, just like this. Then we have to, you see some lines going on there. So these are the lines we put on to do analysis on the whole mechanics of the pelvis, see if they're like how far they're deviated from the normals. And I think there is a picture here as well. This is how we do the examination as well. So we check the movement of the spine. So once we've done all that, then we'll come down to a conclusion. We advise you what we think it is. Then we'll do, the adjustment, which we'll try to move the bone. That's where you hear the crack sound. And the cracking is not that we are breaking the bones or anything. It's just that between the joint, there is a cartilage where there is some gas bubble within. So when you try to move the bone enough, the gas will start to escape the joint. Or it will create a negative pressure. That's why you hear a snap. It's kind of like this, right? It's something, it's a friction. That's why you hear the crack sound.
On the cracking note, I mean, we touched on this earlier in the call, but to answer this question here, someone asking about whether it's advisable to consult chiropractors for back cracking, or whether the consultation is initially better with an X-ray. No, I'm going to say it would depend case by case, right? As you know, we should. Anyway, take it away.
I think the best way is to, if you do have any images already, you can always bring the images with me, and then we'll explain. We'll try to use information that you already have. But if you haven't have any X-ray done before, you can always just go to the chiropractor and let us check first. Reason behind is because when we do an X-ray, we always need to identify which part is the one with problem. Only then we know what to prescribe for the X-ray. We can't take the same X-ray for everyone, right? Some people might need extra, some people doesn't need extra. There is always, other factors that we need to consider. What if the patient is pregnant that she doesn't know she's pregnant, or she doesn't know that pregnant cannot take an X-ray?
Would be
there is a lot of factors. What if the patient already done many X-ray or CT scan before the other practitioner has prescribed, and we think that it's unnecessary for her to take another new one? What if she need another one at the knee or the ankle? All these things have to be considered.
Yeah, no, always very clear like this. Okay, cool. So Daniel, we've just gone over the hour mark, so I think unfortunately we have to wrap this up. But there is one more question I'd like to raise, because I think it might be very valuable for a lot of people watching at home. And that is the regular gym goers, the exercise bunnies, the gym rats, as they're called. So this gentleman pulled his lower back from deadlifting and has felt pain in the lower back ever since. Now, while he cannot seek treatment outside during the MCO period, what advice would you give this person while stretching doesn't seem to be working? Like, what would be an effective or efficient, I don't want to call it quick fix, because of course that isn't the case, but what can they do to mitigate and to manage this pain in the meantime while they can't seek proper corrective therapy for a pain like this? What can they do at home to manage this lower back pain?
I think the first thing that you can do is to use an ice pack. Ice pack is always advisable. So just take an ice pack or anything cold from the fridge, wrap it with a towel, a small thin towel, and then just put it at the area which is painful. A lot of people, they try to use heat pack, but just try not to use heat anywhere near the joint, because if it's heat pack near the joint, it's going to cause more swelling and you're going to have pain after.
Okay. So
and
ice packs for the.
Yeah, and try not to do stretching as well. Stretching will not help. In fact, it will always make it worse if you've injured it. What you want to do is strengthening exercises. And you can do a lot of myofascial therapy that would help. So on my Facebook page, I've done a video. The one that I did recently is to help with lower back problems. So if you do have any lower back problem, you can actually go to my Facebook page and look at the recent video. Those exercises might be able to help to reduce the pain slightly.
How can we? That's fantastic. And how can we find you on Facebook? We've got your Instagram down at the bottom of the screen, but where can we find you on Facebook? What do we search?
Let me check. Yeah, I think it's
Daniel
Chiropractic or something. So you can just go to Facebook, and you can look up to Daniel. You can type Daniel the Chiropractor. Everything's connected. Then you should be able to find me.
That's okay. So we'll just search Daniel Chiropractor, and we'll come across you. There you go.
Can I put?
Okay, excellent. We'll put up some links to your page, and as well, the Instagram is down below, guys. So please. That's all the time we have, unfortunately, for now, Daniel. So thank you very, very much. How the pelvis can be sort of the pathway point for a lot of pain elsewhere in the body, which you would never have guessed. It can knee pain, foot pain, neck pain even. So that is something for our audience at home to consider. If you have, a stiffness somewhere, it might not be where or what you think it is. And if that's the case and it is persistent pain, do consider and seek out proper chiropractic advice. And I think based on the presentation we've seen today, Dr. Daniel here would be the first port of call for that. So, Dr. Daniel, thank you very much for sharing your knowledge with us. It's been a great pleasure having you on board. Guys, do check out his Instagram profile. We'll be sharing out the survey in the comments. I think it's already in the comments, so please fill that out and there'll be more information there. You can also access on the ALYFE group Facebook page. You can also access the shop where we are selling we are selling one of Dr. Daniel's assessment packages at a specially discounted rate. So do check that out. Daniel, thank you again. Stay safe and stay well. And I'll probably be coming to see you myself when this is all over and I can leave the house.
Awesome.
All right.
Thanks.
Thank you very much.
I appreciate everyone.
Take care. It's been a pleasure.
Okay. Take care.
Guys. Bye. All right. Well, everybody, thank you very much for tuning in and asking some great questions. I hope you all found it as informative and as interesting as I did. I apologize if we couldn't get around to your questions. That's simply too much to discuss, I think, in just an hour's session. But do head on over to Daniel's Instagram page and check out his videos. He's giving away a lot of great free content that you can refer to, especially when it comes to exercises, including heavy lifting, lower back pain, which I know a lot of us are suffering from, myself included. So I know that's what I'll be doing. So this brings our second session of day 2 of ALYFE Connects to a close. We will be back online at 6 p.m. with our first happy hour session, and we'll be welcoming a brand ambassador from Martell to discuss with us some cognac and culture around that. So I'm very much looking forward to it. I'm going to go now and do some stretches and work on my neck and, look forward to seeing you guys for the next session. Thank you all again very much for joining us. This is ALYFE Connects. I'm your host, Jacob, and we'll see you again very soon.